Hey, Marshall Bronstein here. Thanks so much for your support and watching my little videos. Today we're going to have a progress report, see how you're doing with some of the techniques I've given you. We'll start with the figure 4, which of course stretches the hip and the external hip rotators. We do this by placing our leg kind of like we're tying our shoelace. And we're going to go down and bend towards the floor, breathing, breathing, breathing. You might measure how far your fingertips are from the floor at a nice resting position. Second, we want to just visually see this leg and note if it's parallel to the floor, or in more severe cases you're going to find it up like this. Ultimately, we want to get it down here. It will come slowly. You can't force it. Okay? When we stretch, we breathe, we exhale, and as we exhale, we increase the stretch more. Let's switch sides. My left side is my affected side, and you can see that the leg is about 2 inches higher than the right. We're going to stretch. I cannot get my fingertips to the floor, but as I breathe, I go down a little bit more, and I do the best I can. I never overstretch. I always do it to a point where I could sustain this position for 2 minutes. We really like to do this 3 times a day. Okay, let's go on to our hamstring stretch. And I think I showed you the little sheet with the knot in the middle. And I'm going to use my right side first. Isn't it funny how you always go to the good side first? And I hope it appears my knee is locked. Sometimes on camera it shows a little angle here. I keep a small pillow around to support my head. The unaffected side and my upper body should be totally relaxed. We grab the sheet high and we torsion it backwards naturally. Just the natural weight of my arms is pulling. So again, I'm not overstretching. I don't feel uncomfortable. I could actually think about something outside of this stretch, and I want to hold it for 2 minutes. Again, locking the knee the very best you can. Good. Let's switch. Maybe you could see that the left is probably less limber than the right. Everything's relaxed. I'm thinking good thoughts. I might even go into my windshield wiper technique. And that's pretty darn good. Okay, now I'm going to turn on my side and we're going to go to a new stretch. This is a quad and hip flexor stretch. Bottom leg slightly bent. Grab the back of the leg, and the stretch is to bring the fibula backwards, straight. I feel this immediately in the front of the thigh and at the front hip bone. I breathe, and as I breathe out, I try to increase the stretch slightly. Let's switch sides. Notice when I get up, I always get up from the side, using my arms for support. Backward stretch. Hips stay forward, only the leg goes backwards. Breathe, breathe, breathe. Thank you. You can email me if you have any questions at drmarsh. It looks like Dr. Marsh at bellsouth.net. Thanks again for your cooperation and your feedback. Have a great day.